started with the pain probably about in 2008 when I began to get active in triathlon. I had never been active, never been a participant in any kind of sport, spent my life raising children and running after them, basically. And once I got started in triathlon, my son had done the Ironman up in Wisconsin, and I'm watching that and thinking how amazing it is for these athletes to be doing this, swim, bike, and run, and I wanted to do that. And I did my first triathlon in 2008. It was a short one, and standing watching the other participants come in, I noticed a pain in my upper left hip area in the back. And I continued on with my training and my triathlon, and to the point where I actually was training for the Ironman, and the pain continued to get worse and worse. At one point it was so bad that you just had to sit. You couldn't keep going. And it just almost brought me to tears. It was like, this is not how I want to live my life. I'm too young for this. So after we pinpointed the SI joint, we decided to try that procedure. The procedure definitely got me back into my life. It allowed me not only to do the training that I wanted to do, it allowed me to go and pick up a prescription and not have to sit down, to walk through Walmart with my grandson without sitting 3 times. I left a cart full of food one time because I couldn't wait in the checkout. So regardless of the Ironman and that training, this procedure was life-changing for me in the fact that I could just do everyday things again without that pain.
I have always known that I've had scoliosis. I was around 54. I started getting extreme pain in my back, and I couldn't walk. My sister worked at the Cleveland Clinic, and she got the best orthopedic doctor, spine doctor, for me, and he fused the bottom of my back. For 3 years, I kept going back to him, and the pain was getting worse. He said that you will always be in pain. I wish that the insurance companies actually knew what SI pain felt like. Having to go through what they will pay for every 4 months is very hard on my body. Life wasn't any fun anymore because it all hurt so much.
Chronic pain is one of the big problems in medical community today, with treating numerous patients with chronic problems that require a lot of care. Coolief procedure can provide 50 to 80% of relief in 60 to 70% of the patients for up to 2 years. It is giving excellent results for relief of chronic pain coming from the sacroiliac joint. I believe that we should try to give more room for education about Coolief procedure, not only among medical community we practice in, but also we should be able to present that to different insurance carriers and show them what are the results of the Coolief and how the patients feel after having that procedure done.
When he was done, all of a sudden, it didn't hurt anymore.
Fully appreciate how you could go from excruciating, horrible pain, and then someone flips the switch off and says, "How's that?" She literally almost danced out of this this procedure.